Hello, in this video we will discuss about the Myasthenia gravis. What is Myasthenia gravis? Let's begin to understand. So the Myasthenia gravis is a chronic autoimmune disorder in which the antibodies destroy the communication between nerves and the muscles. So resulting in weakness and skeletal muscle affect the voluntary muscle. So remember the Myasthenia gravis target the antibody which that will target the auto antibody target to the acetylcholine receptor as well as other sites we will discuss in this video. So a several type of Myasthenia gravis but generally we will understand in this manner. So the basically is the sign and symptom is the eyes which that is not completely open, one eye, mouth, body, limbs and throat. Throat problem, it means the voice will be changed due to the difficulty to swallow as well as difficulty to speak. And this is a thymus gland. Let's begin to understand the thymus gland which that are present upper part of the heart. And the thymoma is the function mean the cancerous thymus gland will produce the autoreactive T cell. So this is the thymus gland important for B cell and T cell maturation, the adaptive immune system. So this is the antigen presentation. The antigen presenting cell will present the antigen acetylcholine receptor via a neuromuscular junction to catch and the MSC class 1 molecule and T cell receptor via a co-stimulatory molecule. After the recognition of the T cell, this T cell will proliferate CD4 positive T cell helper and the T helper 17 and T helper 1 cell. CD4 positive will produce interleukin 4 and interleukin 6. This is the inflammatory cytokines. And the T helper 17 will produce the interleukin 17 and 12. While the interferon gamma, which that is produced from the T helper 1 cell. After this production of the interferon gamma and the interleukin 17 and 12, which that is the B cell, which that will proliferate after the recognition of the antigen. The B cell will produce the anti-acetylcholine receptor antibodies, which that will target to the anti-acetylcholine receptor to block the acetylcholine receptor. So this is the inhibitor of the T helper 17 cell, which that is the brodalumab and ixekizumab and the acukizumab, which that is a difficult name. I can't pronunciation. So here you can see this is the after the antibody production, the auto antibody, the anti-acetylcholine receptor antibody, which that will side to the neuromuscular junction when go through a blood circulatory system. So this immunoglobulin will bind with this manner. After this binding the neuromuscular junction, so in this way the antibody will collapse and the acetylcholine receptor, which that will basically a neuron, which that exocytosis of the neurotransmitter, so the acetylcholine will not bind, and that is why the collapse. And this is a synapse and the motor function of the muscle dysfunction. Anyhow, let's begin to understand the major mechanism of the Myasthenia gravis through a neuromuscular junction. So this green color, the antibody shows the unproven antibody, which that also affect but the research is going on, and the pathogenic antibody is the red color. So after the axonal terminal action potential will lead to efflux of the calcium, will lead to exocytosis of the neurotransmitter vesicle. After the neurotransmitter vesicle will release acetylcholine choline, acetylcholine neurotransmitter will efflux exocytose, will bind with the acetylcholine receptor to stimulate the exchange of sodium potassium exchange, lead to calcium influx from the T tubule. After the T tubule influx will the DHPR receptor will accept and the RYR receptor, which that will influx into the sarcoplasmic reticulum to efflux of the calcium into the cytoplasm. The increasing of the calcium in the cytoplasm will bind with the muscle sarcomere with the troponin and the contracting troponin, which that will contract the sarcomere is the functional unit. So here is the musk and LRT4, which that is stimulate to the cluster formation of the acetylcholine receptor, while on the other hand the degradation of acetylcholine into the choline and acetic acid, which that will again reuptake through a synaptic node. So here is the muscle contraction, and it is the musk and the LRD4 when bind with the agorine, binding agorine to lead to folding to produce the T tubule. So here let's begin to understand in the case of Myasthenia gravis what will be happen. So in this way, here is the thymus gland, which that is the thymus gland, thymoma will be formed. This thymoma will produce the autoreactive T cell. This autoreactive T cell, which that will proliferate, which that will trigger the B cell activation and autoreactive antibody production. So the autoreactive antibody production. So this thymoma autoreactive T cell can be inhibited by the thymectomy. On the other hand, important things you should need to understand, this is the antibodies, the immunoglobulin collectively will produce, which that is unproven and pathogenic. While this antibody can be inhibited by the drug. So we will also learn about in the end of this video. So first of all, we should need to understand this is the target to the neuromuscular junction. After this neuromuscular junction, the T cell receptor will combine with the pathogenic antibodies against this acetylcholine receptor, and in this way the C1 complement, which that will trigger to lead to MAC and cell lysis, and this cell lysis will be occur, and the decreasing of the muscle cell means the weakness of the skeletal muscle. While here the fold destruction also occur due to the C1 complement system activation. While here the blocking of the acetylcholine receptor due to the binding the antibodies against the acetylcholine receptor. While here the action potential, which that will lead to increase the calcium influx, will lead to exocytosis, and this blocking will not bind the acetylcholine with the acetylcholine neurotransmitter receptor. So here the internalization will be occur due to the antigenic modulation, will lead to move into the cytoplasm in the form of vesicle, will lead to degradation of this receptor, acetylcholine receptor. So this is the contraction will be occur. In this way, the contraction will be inhibited due to the blocking of the acetylcholine receptor. While this is the agorine will not bind due to the autoantibody, the unproven can be bind possibly, and in this way the pathogenic also bind with this receptor, and in this way this domain LRD4 and musk domain, the dimeric domain, which that will choose for the acetylcholine to convert the acetic acid and choline through a esterase will be occur, but the agorine will not bind. It means the folding will not occur of the T tubule, as well as cluster of the acetylcholine receptor will be also decrease. So this is the B cell inhibition via these drugs, ocrelizumab, ofatumumab, and binutuzumab, and oblituximab, and nabilizumab, which that is very difficult to understand, and this thymectomy, which that inhibit the autoreactive T cell for the removing of the thymoma, the thymus gland dysfunction will remove. On the other hand, the inhibition of the antibodies through a azathioprine, mycophenolate, mofetil, and methotrexate, cyclosporine, and the rituximab, and plasma exchange. So this is the T cell basically convert into the T helper 1 cell and the T helper 17, which that will ultimately trigger the B cell. After the triggering of the B cell to proliferate the plasma cell and B memory cell. This plasma cell will produce the immunoglobulin. This plasma cell will produce the immunoglobulin, and this immunoglobulin basically can be inhibited by the plasma exchange also. So this is the basic mechanism to understand. So let's understand about the severe case of myasthenia. This severe case which that will go the ventilation, the patient should be ventilated. Ventilation, the artificial ventilation, and the plasma exchange can be occur, and the remove of thymus gland due to the surgery. While the risk factor can be a personal history, family history of autoimmune disorder, and men over 60 can be a risk factor, and the women over 40 can be a risk factor. And the medication can be also the problem for creation of myasthenia gravis. So thanks for watching. This was the myasthenia gravis disease, which that is the autoimmune disorder due to the autoimmune activation, the T cell, autoreactive T cell. So thanks for watching. Bye.